We got a great question that came in. How do you stop the advancement and the pain of rheumatoid arthritis? Well, in the conventional medical model, you have these ANA titers, inflammation markers, you have rheumatoid arthritis markers, so to speak, and people are suffering and the disease is progressing. So they use a fancy class of drugs, I won't name them by name, called tumor necrosis factor alpha blockers. Basically, they're blocking inflammation. I did a wonderful video, you can request that from us, we'll send that to you, on how rheumatoid arthritis, fibromyalgia, a lot of these inflammatory diseases actually have their causes in infectious diseases and how they cause a dysregulation in your immune system to attack your own tissue, autoimmune disease. So what we do is, first of all, look at the cause. Rheumatoid arthritis has different causes in patients. There have been a number of infections we have found over the years with patients that have RA. And interestingly enough, before that, years ago, doctors would even use IV antibiotics and patients would have some resolution, which tells you something quite interesting. There could be an infectious etiology to your rheumatoid arthritis. Not every patient is different. There could be chemical exposures and toxicities that are playing a role. And for sure, immune system problems where the immune system is hyperactive to attacking the tissue. These things have to be corrected, and they're done through personalized medicine where we break down all of these, from nutritional deficiencies to hormonal changes to infectious origins, many different types of infections, looking at what's causing the disease, what's bringing the inflammation, re-regulating that immune system so that it's operating properly, and that's how you properly stop it, because then you slow down the progression of the disease and you improve the quality of life with less need of medication. In fact, in many cases, some of our patients don't need to take medication anymore because they're properly treated. And that's my recommendations. I always like to get to the cause and get to why people are sick. Not that the medications aren't helpful, but they're kind of a long-term thing. You take them and then you go to the next drug. A lot of the drugs that are on the market today aren't giving the long-term resolutions. They're giving some help, but they're not really solving the long-term picture that patients really deserve. So I hope this helps to answer some of your question on rheumatoid arthritis, and may God bless you on your journey to healing.